We are in Singapore to stress and reaffirm our enduring relationship to this country and in this region, and to reinforce a shared vision of a free and open Indo-Pacific region, and to reaffirm our mutual interests in peace and stability in Southeast Asia.
U.S. Vice President Kamala Harris and Singapore's Prime Minister Lee Hsien Loong speak of both nations' deep cooperation in multiple areas. COVID-19 in Singapore, why has the number of deaths increased, even as vaccination rates gone up? And the Health Ministry warns it will take action if needed against anyone who is caught selling their Sinovac vaccination slots. Good evening, you're watching The Big Story coming to you live from the Straits Times newsroom. I'm Haryanto Diman. You can subscribe to the Straits Times channel so you never miss a single episode. Singapore and the United States are long-standing partners, and both countries are looking to deepen their relationship in new areas, including current and future pandemics, climate change and cybersecurity, while remaining committed to more traditional issues like security and economic cooperation. Prime Minister Lee Hsien Loong and U.S. Vice President Kamala Harris spoke on a wide range of topics this afternoon, and here's what emerged from the meeting.
The Vice President's visit follows Secretary of Defense Lloyd Austin's visit here just a month ago. It emphasizes the U.S. administration's commitment to this region and shows that the U.S. has both strategic and economic stakes in Southeast Asia. We value the U.S. renewing its ties with friends and partners here, and especially with Singapore. Economic cooperation between the U.S. and Singapore is dynamic and flourishing.
We are in Singapore to stress and reaffirm our enduring relationship to this country and in this region, and to reinforce a shared vision of a free and open Indo-Pacific region, and to reaffirm our mutual interests in peace and stability in Southeast Asia. Prime Minister Lee and I had a productive conversation on how our two nations can partner together to fulfill this vision. In that context, Prime Minister, I thank you for the very generous offer that you've made to assist the United States in our evacuations from Afghanistan, and we look forward to following up on that discussion.
It's been a very busy day for Ms. Harris, starting with an official welcome by the Guard of Honor this morning. During her visit to the Istana, she also called President Halimah Yacob and had a new Orchid hybrid named in her honor. She will also visit Changi Naval Base and the U.S. littoral combat ship USS Tulsa, which is in port for a multilateral exercise. For more on this, I'm joined by foreign editor of the Straits Times, Bhagya Srigareka. Welcome to the show, Bhagya. Bhagya, an array of topics were brought up during the joint press conference, including new partnership areas that both the US and Singapore are entering, like cybersecurity, climate and economic cooperation. Bhagya, what are the main takeaways from the session?
Okay, for me, one thing that jumps out and which is actually in the world headlines all over is basically Singapore's generous offer of the RSF plane to help with the evacuation and the airlift operations in Afghanistan. The second thing on economy, and I think you've named some of those things, the one big one, which again is subject of concern everywhere, is to do with supply chains. So US and Singapore are looking to resolve this issue. Because of COVID, there has been a backlog, which clogged up manufacturing all the way in the region, all the way to the US. So that is problematic for manufacturers, problematic for car makers and so on. So Vice President Kamala Harris lent her support to be able to solve this issue. The other thing are the new areas that you mentioned, climate, green energy, finance, green finance, clean transportation, smart city initiatives. Coming back to defense, you also have the cyber, the pact on deepening cooperation on cyber attacks. Now that is important because we increasingly see cyber hacks happening across the world. So those are some very key and important takeaways from today.
Right. But can you help us understand what is the significance of Ms. Harris's visit, to Singapore and of course beyond Singapore as well, to the Southeast region in general?
Okay, so Singapore, firstly, well, she showed up. And that's good because it matters. With President Trump, former President Trump, he skipped at least 2 important ASEAN meetings. And that does not go down well with the region. So she comes here, she is a vice president, the second most senior member of President Biden's cabinet. So it's good to see her, at the Istana with Prime Minister Lee. And the other thing I would say is, well, vice presidents are important people, right? And some of them become presidents. So we appreciate her being here. Then think about her, her biography. So like many Singaporeans, she has roots in the Indian state of Tamil Nadu. Her mother was an immigrant from Tamil Nadu. So I think that's a nice connection, I think, that many Singaporeans will see in this visit. Beyond that, let's look at the region. So, it's been now 8 months since the Biden administration came in, and it had seemed in the beginning that they were very much focused on Europe and on Middle East when it came to foreign policy. Southeast Asia wasn't figuring very high, but the last 2 months have been pretty good. So there were high-profile visits. There was the Secretary of Defense, Lloyd Austin, visiting Singapore and other countries in the region. You had the Secretary of State, Antony Blinken, meeting virtually with many of the ASEAN foreign ministers. So all this, and then now you have the Vice President. So what does this go on to show? It goes on to show you, especially in the backdrop of events in Afghanistan, that Mrs. Harris was here to say that US understands its commitment to the region. It has an enduring commitment. I think that's a word that you heard her say, and you will hear her say again tomorrow, I think, because she has an important speech that she's going to be making, and she will talk more about the imperatives of the US presence here.
I've been speaking with Bhagyashree Gareka, the Straits Times' foreign editor. Now you can visit straitstimes.com for more on US VP Kamala Harris's visit to Singapore. A quick look at Singapore's vaccination progress. As at August 21st, more than 4.2 million people have completed the full vaccination regimen, including those who have received the shots recognized in WHO's emergency use listing. 78% of the population are fully vaccinated, as you can see from the orange line here, and 82% have received at least 1 dose. Meanwhile, the Health Ministry last night reported 2 more deaths due to COVID-19 complications. The first, a 91-year-old unvaccinated woman who was a PR, died on Saturday. And the second, an 87-year-old Singaporean man who was partially vaccinated, died yesterday. Singapore's virus death toll now stands at 49. To share some perspectives, Professor Teo Yik Ying joins me now. He's the Dean of the Saw Swee Hock School of Public Health at the National University of Singapore. Welcome back to the show, Professor. Professor, Singapore has reported 12 COVID-19 deaths just this month alone. This even as more than 3/4 of the population are fully vaccinated. Why are we seeing more deaths, and should we be concerned?
Thank you for having me back. So this is certainly a very important topic, and we should definitely be concerned. Because at the peak of the COVID outbreak last year, where we had more than 1,000 cases reported daily, even during then, we never had so many deaths happening within such a short span of time, within 3 to 4 weeks. So exactly what are the reasons that are causing all these deaths? I think firstly, it's really all the cases that we've seen in the past 8 weeks are mostly caused by the Delta variant. The data from Singapore as well as overseas consistently show that people who are infected with the Delta variant have a much higher viral load, and these infected people are also more likely to experience severe symptoms compared to the previous version of the coronavirus that was circulating in Singapore back in 2020. And the second reason is really because the outbreaks over the past 8 weeks have happened in community spaces where the seniors tend to hang out, such as wet markets, food centers, and a number of these seniors have indeed been infected. We have seen that those who are vaccinated are much less likely to develop severe symptoms and to need hospital care. Not that these vaccinated people are completely free from severe symptoms, but the chance of anyone who has been fully vaccinated to develop severe symptoms is really much, much lower. But some of these seniors who have been infected, unfortunately, were not vaccinated. A few of them got really sick because of the infection, and we have seen 11 of these unvaccinated or partially vaccinated people have passed on. So last year, when we saw thousands of infections happen every week, the vast majority happened amongst migrant workers who generally are younger and in good health. So they were also not infected by the Delta variant. So when you ask the question, should we be concerned? My answer is clearly a yes, we should be concerned, because people who have not been vaccinated, if they do not have any medical problems that make them ineligible for vaccination, these people should really consider vaccinating themselves. Or if you know someone like that, to try and convince them to go for the vaccination. It's literally going to be a gift of life from you to that person. Because I think over and over again, local, overseas data, we have seen very clear conclusions that for someone who is fully vaccinated, if he or she does become infected with the Delta variant, this person is still going to be very much more protected against any serious or deadly effects of the infection. So I cannot emphasize more about how going for the vaccination is going to be a conscious, active decision that you choose life for yourself and for your loved ones.
Professor, we're about a week away from the next stage of our reopening plans, and Singapore continues to transition to endemic COVID. Differentiated rules based on vaccination status are likely to remain. So to your point, Professor, vaccination is important, but what would these mean for those who are unvaccinated and children below 12 years old who are only likely to receive their jabs early next year?
So actually, we don't have to look at next week. We can already look at the current situation and what it means for the unvaccinated, including children under 12. Because when we start to lift our restrictions even more, whether it is in September, later on in the year, or even next year, the risk will only go up. And what is this risk that I talk about? So I think when more people return to work, when we allow more social and dining gatherings to happen, we expect to see more and more human-to-human interactions take place. Now, the greater degree of such interactions, regardless of whether it is between vaccinated or unvaccinated people, it actually means that there is going to be this richer environment for the coronavirus to spread in the society. So as long as one is moving about in public, whether it is going for work, for meals with families and friends, there is now a chance of being infected, especially with the highly transmissible Delta variant that is driving a lot of the infection in Singapore. So the first risk is that people will get infected. Many of them, because of our high vaccination rate, will be asymptomatic, will be mildly symptomatic. And because many of these infected people with no symptoms, they may not know themselves that they have been infected. So they will inevitably pass it on to other people. So there will be a chance that infection numbers will increase. But as long as most of the infection happens amongst unvaccinated people, I actually do not expect a large number will develop severe symptoms. Now, the problem comes, which is exactly your point, when unvaccinated people similarly move about in public spaces and be exposed to the coronavirus. Or it could also be that the unvaccinated person actually stays at home most of the time, but lives in a household where there are others who are actively going out and mingling with friends. And these household members may bring back the infection back home to infect the person who is still unvaccinated. And this is when I worry a lot for the unvaccinated, because they will be at a much higher risk of serious disease when infected, especially if they are old or have underlying medical conditions. Now, we talk a lot about seniors now. I think it's important to also emphasize the children, because for children under 12, they will be equally unvaccinated because they are not eligible yet. I expect some of them will be infected when they move about or when their parents, family members move about. By and large, many of them who are infected, many of these children will be healthy and they will have no underlying health problems. So when they're infected, most of them will just shake off the infection with no long-term harm. But, and I think this is the very important but, and I hope parents who are listening will pay attention to this, because there will be some children who have respiratory conditions, some children who have underlying medical problems that may be linked to the immune system, or even some malnourished children who are not eating well. They may not be at optimal health. These children can potentially develop serious symptoms if infected. And I think we need parents to understand that if they do have a child who has some medical condition, it is very important to make sure that the parents themselves, the household members, the child, they are careful with their activities in order to minimize any exposure to the coronavirus. And I think this includes letting perhaps the parents, they let their employers know about prioritizing them to work from home, because I think moving on, there will be some degree of returning to the office. So some of these people should be prioritized at the workplace to continue working from home and to minimize moving about in crowded public spaces.
Prof, during the joint press conference earlier between US VP Kamala Harris and Prime Minister Lee Hsien Loong, PM was asked what it would take to agree to a quarantine-free travel arrangement with countries like the US. Let's have a listen.
We have been very tight on our borders for some time because it was necessary, and we had to get our situation in Singapore secured through vaccinations and through infections control. I think we are getting there, but we are nowhere near herd immunity. And we are now able to contemplate vaccinated, safe, quarantine-free travel with conditions and tests and procedures with countries. And we are starting with 2 countries, Germany and Brunei. And we are talking about other countries as well, and it will depend on the vaccination progress in those countries. It will depend on the prevalence of COVID in those countries, the state of the pandemic, and it depends what we can work out between us so that you have confidence in pre-departure testing, pre-departure vaccination certificates, and then procedures upon arrival to be tested and, if necessary, to be quarantined if infected. It's something which we have strongly in mind because it's important for Singapore as a hub to be able to reopen and to operate safely, and for people to travel back and forth to do business and to keep ourselves connected with the world. And the US is one of the countries which we will be pursuing these conversations with.
So when PM Lee said Singapore is, quote, nowhere near herd immunity, what does that mean, Prof?
So my sense is that when Prime Minister Lee talked about herd immunity, he was being very cautious here, because I believe he's referring to the fact that there remains segments of the population in Singapore that are still not vaccinated. And this definitely includes the children that I talked about earlier on, as well as some of the adults who may not be eligible at the present time to take the mRNA vaccines. So we are waiting for the other vaccines to be ready for distributions, such as perhaps Novavax, or when Sinovac or Sinopharm are ready to be approved by HSA in Singapore. Because only when we are able to vaccinate the majority of our population, will we be in a much more confident state to open up our borders to allow quarantine-free travel into the country. But I think it's also important to highlight that this concept of herd immunity, typically it refers to when you have enough people in the country vaccinated or naturally exposed to the point that there is a certain degree of immunity that exists within the population. The risk of being infected is lower, the risk of severe disease is low. But I think given that what we have seen with Delta variant, it's really going to be a situation where I imagine even when we vaccinate the entire population, I do believe in endemic COVID-19, there will still be some background infections happening in the population amongst people who are vaccinated, just that most of them will not have any severe disease or any risk of dying from it, but there will still be some infection. But most importantly, right now, the reason why we are not opening our borders to quarantine-free travel just yet so quickly to most countries is really the fact that we have yet to vaccinate important segments of our population, including the children, including some of the adults that are not eligible. So I believe that PM was very cautious to say that we will do that when we are able to reach higher degree of vaccination.
Well, thank you so much, Professor Teo, for the insights. Professor Teo Yik Ying, Dean of NUS's Saw Swee Hock School of Public Health. In the latest guidelines by Singapore's Manpower Tripartite Partners released this afternoon, all employers have been urged to consider implementing a regime for existing employees and new hires to get vaccinated or undergo regular tests. Employers may also ask staff who are eligible but choose not to be vaccinated to pay for regular testing and exclude them from medical benefits linked to COVID-19. The tripartite partners said these expenses can be recovered either through salary deductions or requiring these employees to pay the relevant service provider directly. While employers should not terminate or threaten to fire an employee on the basis of vaccination status alone, they can terminate an unvaccinated staff who does not comply with reasonable vaccination differentiated workplace measures. Meanwhile, responding to queries from the Straits Times yesterday, the Health Ministry said they will watch out for any sale of Sinovac vaccination slots and take enforcement action against people who exploit others by partaking in such acts. Last Wednesday, checks by ST found 4 people on Carousel offering between $50 and $80 to buy these slots. In a statement today, Carousel said listings of vaccination slots are strictly prohibited and it has removed such listings from its platform. A quick look at the other headlines for the day. Work has begun for Malaysia's new Prime Minister, Mr. Ismail Sabri Yaakob, on his first day in office today, making his first official visit as PM to the flood-hit areas in Kedah. He was briefed on the current situation and the extent of damage to the affected areas. In his maiden speech yesterday, Mr. Ismail emphasized cooperation across the political divide and invited opposition leaders to join in the effort to tackle the COVID-19 pandemic. Although they are open to the Premier's offer, opposition lawmakers said they wanted something substantial that genuinely fulfills the spirit of bipartisanship. Back home, inspection work has found a JTC Cooperation building and 3 surrounding buildings to be structurally safe. Yesterday, parts of decorative features on a concrete roof of the JTC building crashed to the ground. JTC said today permanent rectification works are still ongoing, but cleaning of the incident area will end soon. As a safety measure, the tenants in the affected wing of the building from levels 1 to 4 are still unable to return to their units during the cleaning and rectifying process. Separately, Minister for Trade and Industry Gan Kim Yong said today that the 5G broadband cellular networks will cover half of Singapore by the end of 2022, and the coverage will extend island-wide by the close of 2025. He noted 5G networks will help spur innovation, create exciting business and job opportunities, as well as position Singapore as a leading digital economy. Trials on 5G applications are also underway, including at the Port of Singapore Authority to improve port operations and a technology firm Razer to deliver high-quality cloud gaming products. And if you're planning a trip to the Merlion Park this week, do note that the main Merlion statue there will be undergoing overnight routine cleaning and maintenance works from August 26th to 28th. During this time, the statue will be hoarded up and will not be available for photo taking. And those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below. I'm Haryanto Diman. Join me tomorrow for more stories on A Big Story.